Hello, I'm Alex Smith. I'm a journalist at Community High School.
Hi Alex, I'm Alex Plum. I'm the CEO at the Corner Health Center.
Nice to meet you. Can you start by explaining what Corner Health Center is and really primarily serve?
Yeah, the Corner Health Center is ultimately an adolescent health center. We serve young people between the ages of 12 and 25 and their children. We started 45 years ago providing teenage pregnancy prevention, education, and services at Ypsilanti High School. Actually on the second floor at Ypsi High in the corner broom closet, and that's why we're called the Corner. In the 80s, when we could no longer do contraception in schools, we moved out into our own building, and since then we've been providing a one-stop shop of services for young people and their families ever since. We're a traditional doctor's office. We've got doctors and nurses and care providers for a whole host of specialties to take care of what's wrong with the body. We have therapists and case managers to help young people with mental health issues take care of what's wrong with the mind. We have a free store in our basement. It's got clothing and food and household items to help take care of the social issues that young people might have. And then we've got a whole team of health educators and program people. We've got programs for young dads and for young moms. We have a youth leadership council. We have a summer program. So we have all this kind of education outreach work. So we try to, one of the things we know about young people is when there's an issue above the surface, there's often a lot more below the surface. And so we try to provide as many things as we can in one spot to help them.
What are some administration strategies or enforcement strategies that this administration is using to put pressure on healthcare administrators?
That's a good question. I think there's a number of things. Congress, of course, recently passed some budget laws that last year rescinded a ton of Medicaid eligibility for people. And so in the next couple of years, we're going to begin to see those people lose Medicaid eligibility. Folks with low incomes, folks that at a certain point after their children are a certain age, people who otherwise qualified for Medicaid. That's going to be a huge challenge because Medicaid is the insurance provider for most low-income people. And then, so that's one challenge. I think the other challenge, which we're increasingly seeing, is in the gender-affirming care space. This administration has, for some reason, really inexplicably characterized gender-affirming care as immoral or as illegal, and that's really incredible. I mean, it's an awful, very confusing, terrible thing. Gender-affirming care is evidence-based. It's high-quality care. It's care that is very responsible. It's care that's moral. It's care that's ethical. It's care that's legal. And this administration is trying to characterize it as something else. And as a function of that, they've begun to do things like issue subpoenas and start fishing for patient information from some of the major hospitals in this country. And I think what they're trying to do is create a climate of fear so that those providers will stop doing that care without even having to go to court, without even having to change the law. If you can create a climate of fear fast enough, people will just back down without even being forced to. And unfortunately, that's what we're seeing in our state right now, particularly with respect to gender-affirming care.
Prior to this administration, how secure was gender-affirming care? And what may happen to the Corner Health Center if rollbacks begin and financially it's not?
Yeah. Before this administration, access to gender-affirming care was secure. In Michigan, we require the involvement of parents if we're talking to a young person who needs gender-affirming care that's under age 18. Gender-affirming care can look different based on the young person's needs. The care that you might provide a 13 or 14-year-old is probably going to look a little different than a 16, 17-year-old. And of course, and then after 18, it can look very different from that. When you're working with people under 18, we're not doing surgical interventions. In fact, almost all the care that we're doing, certainly all the care the Corner provides, is reversible. I don't think it has to be reversible. I think the vast, vast, vast majority of young people who need gender-affirming care don't ever intend for it to be reversed. But for that very small section that, there's a difference, then we can reverse it, right? So that care has always been a care process that we engage the family on. This is something that we're working with families who have a young child or a loved one who's known from a very, very early age. And this is increasingly in our society. It may be that by the time a young person gets to high school, their parents and their social network have no clue that this child's natal sex is different than what their gender expression currently is. Can you imagine thinking that your best friend, because your best friend's a boy, you've always known your best friend as a boy, why would you know that they were natally, female? You just wouldn't know. And so the law requiring, parents to stop doing that, or these threats that would happen, is just, it's wild. It's really, really wild. So that was the before time. This wasn't a concern. And now, of course, with these threats and stuff, I think the biggest challenge to us would be, one would be if they passed a law that said we couldn't do this care. I don't see how there can be a federal law about that. And I do not believe in Michigan that the politics are such that we'd ever see a state law, certainly not in the short term. The other thing that could happen, of course, is Medicaid ineligibility. The government is threatening right now, potentially, organizations who provide gender-affirming care would lose their Medicaid eligibility. And we've already seen this loss of Medicaid eligibility on the part of low-income folks. If they now also deem that this care, or even anyone that just provides that care, can't get Medicaid at all as an organization, the corner could potentially close. And so we're working right now really hard with some community partners. We're working in the state. We're working with some legal entities in order to kind of ensure that the corner, no matter what happens with our Medicaid, this services will continue to be provided.
Perfect. Are there worries with all of these larger organizations like Michigan Medicine rejecting gender-affirming care and pivoting away from it, that students and children would be unaware of the presence of gender-affirming care or availability of gender-affirming care in the area?
I would say no, and I'll tell you why. To a person, the physicians that I've worked with at Michigan Medicine, at Trinity, at Cornwall, these are very, very dedicated providers. They're very, very heartbroken at sort of what the state of the political climate that's been created in this country. So I am very confident that those providers, pediatricians, family medicine docs, are going to be letting patients know this is what's available, and here's where you can go get it. And this is why the corner has been working with Michigan Medicine. We work with Trinity. We work with all of the providers in our community because we're a good partner. And we've always shared patients. We've always referred. We don't do surgeries, right? So if a patient needs surgery, we're going to send them to a doctor at one of those hospitals. So that's been a reciprocal relationship, and I think that's going to continue.
Do you expect these treatments to become less affordable? And if so, how do you plan to combat that issue?
Oh, that's a really good question. I don't know if they'll be more or less affordable. The reality is there's not a tremendous cost associated with gender-affirming care. Hormones are expensive. They can be expensive. Testosterone is a controlled substance, right? So that can be hard. And then puberty pausers particularly have various prices. That's where the main expense is. Otherwise, the expense is around a doctor's visit. You come in for a primary care visit. When you start on hormones, you typically need labs, and so those have an expense. The challenge will become if Medicaid stops reimbursing, if commercial insurance follows. And so if commercial insurance won't reimburse, that means that you're just out of pocket for everything. But if we're in that space, organizations like the Corner are going to devise new ways of providing this care, and we're going to do it in partnership with philanthropy. So the care will still be evidence-based. We're still going to get the labs. We're still going to prescribe the medications that are necessary, but we're going to use philanthropy. We'll use grants. We'll use donations to help offset those costs. What we're committed to doing, and by the way, this has always been the Corner's mission, to provide affordable, judgment-free care. Affordable, judgment-free care. So what that means is we never send patients to collections. We never report a patient's outstanding balances to a collections agency. We work with patients, and if we have to write off it, then we write the care off. If we put them on a sliding scale, we'll put them on a sliding scale. So organizations like ours are going to be committed to working collaboratively with families, with young people, to make sure they get the care they need.
Are there any federal or local officials that have taken meaningful steps to protect access that you would like to shout out?
Yeah, absolutely. Most locally here in Ann Arbor, I would acknowledge City Council Member Radina, been tremendously supportive of our work, particularly in Ann Arbor and ordinances and just thinking through how to support the community. Representative Jason Morgan at the State House has been really, really supportive. Representative Jimmy Wilson in Ypsilanti is a huge supporter of the Corners, as is Senator Irwin. Senator McMorrow, who's running for U.S. Senate, has been someone that, in fact, I just talked to her a couple weeks ago. So Representative Dingle, Congresswoman Dingle. We're very, very fortunate in this community, particularly, to have a tremendous amount of support locally. I would note Annie Somerville, particularly Andy Labar, both county commissioners, also tremendously supportive. So we're just surrounded by really supportive publicly elected officials.
That's amazing. And finally, what is something that you would like community students to do to help publicize this care?
I think you have to do what young people have done forever. which is be unafraid to challenge authority. What you have right now happening around us is inexplicable, and I think sometimes the best advice that we get as leaders, as people in the business world, people who are making decisions, we lose focus, we forget the essentials, and young people have a way of reminding us of what's actually important. So whether that means you're protesting, whether that means you're calling your elected officials, whether that means that you're showing up, whether it means you're putting pressure on your parents or family members, whatever it looks like for you to be advocating, to be challenging people in positions of authority to do the right thing, I would encourage you to keep doing that. For your classmates, for your friends, particularly folks in the LGBTQ community, folks who are trans, are gender nonconforming, just be solid allies, be people who are there, who can be present, who can be trusted. Just being trustworthy and being visibly trustworthy right now is probably one of the most important things that you can do. And tell folks what the corner is doing, and that we're here, that we're a trusted ally in this care as well, and we're here for patients needing gender-affirming care. We're here for young people that really need any kind of care. And if you do those things, I think we're going to continue to see positive change continue to happen in this country.
Thank you.